This is what the 11 to 12-month results of a hair transplant look like. Do you also want such amazing results for yourself? Then right now, book a consultation with our experts at your nearest location, whether it Delhi, Hyderabad, and Haridwar. In this video, we'll take you through the journey of our 3 patients whose incredible results you just saw. These patients were facing different grades of baldness that not only changed their appearance but also lowered their confidence. Watch how their look and personality were completely restored through advanced hair transplant techniques. Stay tuned till the end to see how a perfect hairline can bring back your youthful charm and confidence. These are our 3 patients. Patient 1 had a baldness of diffuse grade 4 stage, patient 2 had a baldness of Norwood grade 4 stage, and patient 3 had an advanced diffuse grade 6 stage of baldness. All 3 patients faced different challenges in life due to this baldness. One stopped attending social gatherings, and the other became hesitant in taking pictures. All of them tried different home remedies and medication, but nothing worked out, and the hair fall continued to become worse, and the main cause of their baldness was their genetics. Let's start with patient 1's scalp condition. He had a visibly receded hairline in an M-shaped pattern, leading to the temporal recession, due to which his temples had also receded. In this, his overall facial frame was affected. The frontal area also appeared bald from the sides and thinned from the mid part. The remaining frontal area and mid-scalp area were healthy and don't need any intervention, but his crown region was affected by the thinning. His front was more affected compared to the crown region. The positive part in his case was his dense donor area, which was filled with plenty of healthy hair follicles. Now let's move to patient 2. Patient 2 had a baldness of Norwood grade 4 stage, in which his hairline had also receded in an M shape, but not as much as that of patient 1. The temporal sides have also receded, resulting in slightly receded temples, affecting his overall facial frame, due to which the forehead appears wide, just like patient 1. But his front was less affected as compared to patient 1. The remaining frontal area and mid-scalp had healthy hair growth, and it won't need any intervention, but the large area of the crown region was affected. The swirl was intact, but the volume was diminished, and the strands visible in his crown region were weak, as happened in the Norwood stage of baldness. But the positive part was his healthy donor area, which would provide follicles for a hair transplant. Finally, patient 3 had an advanced stage of baldness, which made him look older than his actual age. In this stage of baldness, his hairline had vanished, as only a few strands were visible in his hairline zone. The frontal area also appears almost sparse. Mid-scalp and crown region were affected by the thinning. In the crown region, the swirl pattern was intact, but the volume was diminished around it. The positive part in his case was also his healthy donor area, which played a crucial role in hair transplant surgery. In summary, patient 1 and patient 2 had similar grades of baldness but different patterns, diffuse versus Norwood. In diffuse baldness, the front is more affected than the crown, whereas in Norwood baldness, the crown is more affected than the front. This distinction clearly defines their individual baldness patterns. If you're also facing similar challenges, then right now, share your scalp picture with our experts, and they'll guide you on what works best for you: medication or hair transplant. After a detailed scalp analysis, the next crucial step was hairline designing, a process that defines the overall outcome and natural appearance of the transplant. At QHT Clinic, each hairline is crafted with precision and artistic vision. For patient 1, our experts designed a customized hairline that complemented his facial proportions and restored his youthful frame. The temples were carefully reconstructed to recreate a natural contour, while the affected frontal zone was outlined for dense graft placement. The crown region, which showed mild thinning, was also marked separately to ensure an even and harmonious coverage. In the case of patient 2, a similar approach was followed, with special attention given to maintaining symmetry and natural density distribution. His receded hairline and temple points were redefined to enhance his facial balance. The frontal zone was mapped precisely, and the crown region, where thinning was more evident, was separately outlined to achieve a uniform transition from front to back. For patient 3, a comprehensive hairline design was created to cover the extensive baldness. The entire affected region, including the front, mid-scalp and crown, was outlined strategically to ensure a seamless, natural restoration. These precise markings acted as a surgical roadmap, ensuring a natural, well-balanced, and aesthetically pleasing outcome for all 3 patients. Once the hairline designs were finalized, the surgical procedure began, a stage where planning transformed into precise execution. At QHT Clinic, every step is performed with expert precision and utmost care to ensure both safety and natural-looking results. To provide complete comfort throughout the process, local anesthesia was administered to all 3 patients, making the procedure completely painless and smooth. After anesthesia, recipient site creation was the first step. Tiny, artistically angled slits were made in the bald or thinning areas. These slits defined the direction, depth, and angle for each graft to get natural hair growth. Using the advanced QHT, Quick Hair Transplant technique, extraction and implantation were performed simultaneously, which enhanced the follicle survival rate and minimized out-of-body time. For patient 1, single and thin hair follicles were implanted in the hairline and temple zones to achieve a soft, natural transition. In the frontal area, double and triple hair follicles were implanted to build density and create a fuller appearance. The crown region received grafts implanted at specific angles to replicate the natural swirl pattern and increase volume around it. In his case, a total of 4,300 grafts were implanted, all extracted from the safe donor zone, ensuring natural texture and consistent density. For patient 2, a similar but individually customized approach was followed. The hairline and temples were reconstructed with single and thin hair follicles, implanted in an irregular pattern to create natural growth. In the frontal zone, double and triple hair follicles were implanted to restore fullness, while in the crown region, grafts were angled precisely to recreate the swirl and enhance coverage. In his procedure, a total of 4,000 grafts were implanted, all carefully extracted from the patient's safe donor zone. For patient 3, who had a more advanced stage of baldness, the focus was on achieving balanced coverage across a larger surface area. In the hairline zone, single and thin hair follicles were implanted to maintain a natural, soft look. In the frontal and mid-scalp regions, double and triple hair follicles were implanted to add density and volume. The crown region also received dense packing with double and triple hair follicles, angled to follow the natural swirl pattern. Each of these surgeries was completed with precision under QHT's advanced technique, ensuring maximum graft survival, faster healing, and the most natural-looking transformation for every patient. If you want to know more, comment on hair transplant. 1 month after the hair transplant procedure, all 3 patients entered the initial recovery and shedding phase, a completely natural stage of the hair growth cycle. Patient 1 and patient 3 visited the clinic in person for their 1-month follow-up, while patient 2 shared his progress pictures online as he couldn't attend the review in person. During the evaluation of patient 1, our experts observed around 60% shedding in the transplanted area, a normal part of the post-transplant process. This temporary shedding indicates that the implanted follicles are entering the resting phase before beginning new growth. Mild redness was still visible in the transplanted zone, which is expected and fades gradually over time. The native hair follicles were growing at their natural pace. Even with short hair regrowth, no visible scarring was noticeable, reflecting the precision of the QHT extraction technique. In the case of patient 2, approximately 80% of the transplanted follicles had shed within the first month, as seen in the pictures he shared. His native hair was growing normally, showing healthy scalp activity. The shedding percentage, though slightly higher than others, still remained within the normal range and indicated a positive recovery. For patient 3, our experts recorded around 70% shedding in the transplanted area. Similar to the other 2 patients, his native hair growth continued naturally. Across all 3 patients, there were no scabs, infections, or abnormalities visible on the scalp. The healing process was progressing exactly as expected, and all were well within the normal recovery timeline. At this visit, patient 1 and patient 3 also underwent their first PRP, platelet-rich plasma session. This treatment helps nourish the transplanted follicles by supplying essential growth factors and improving blood circulation to the scalp. The PRP session plays a key role in stimulating early follicle activation and accelerating new hair growth. Overall, each patient's 1-month progress was healthy, consistent, and on track for optimal results in the coming months. 3 months after the hair transplant, patient 1 visited the clinic for his next follow-up consultation. During this visit, our experts noted that the shedding phase had successfully concluded, marking the end of the initial post-transplant cycle. Encouragingly, baby hairs had begun to emerge in the transplanted areas, indicating that the follicles were now entering the early growth phase. The native hair in the surrounding areas appeared healthy and mature, providing a strong contrast to the new, finer strands that were just beginning to surface. This stage is a significant milestone in the recovery process, as it marks the start of visible results. Overall, the progress at 3 months was right on track, with no complications or delays. In the coming months, these new hairs will thicken, mature, and blend naturally with the native hair, leading to fuller and more defined hair growth on the scalp. At the 2-month mark, patient 2, who had earlier shared his 1-month progress pictures, visited the clinic for his in-person follow-up. During this visit, our experts observed that all the transplanted strands had shed, which is a completely normal part of the post-transplant cycle. At this stage, only the native hair was visible on his scalp, while the transplanted follicles were entering their resting phase before new growth begins. To stimulate and accelerate the upcoming growth phase, he underwent his first PRP, platelet-rich plasma therapy session. PRP helps rejuvenate the follicles by improving blood circulation and delivering essential nutrients to the scalp. The donor area had also healed completely within 2 months. The skin appeared smooth and healthy, with no visible scars or irregularities. Overall, his recovery was smooth, and his scalp condition indicated a positive response toward the upcoming growth phase. 4 months after his hair transplant, patient 3 visited the clinic for his follow-up evaluation. At this stage, our experts observed that the shedding phase had completely concluded, and the scalp had healed well. However, the transplanted follicles had not yet fully transitioned into the active growth phase, which is entirely normal at this point in the recovery process. Hair growth timelines can vary from person to person, depending on individual hair cycles and follicle activation rates. While visible regrowth may appear slightly delayed for some patients, the underlying follicles remain healthy and active beneath the scalp. Overall, the progress of patient 3 was consistent and on track. In the upcoming months, he is expected to experience visible sprouting and gradual thickening of hair, marking the beginning of his active growth phase. In the 2, 3, and 4-month follow-ups, all 3 patients had completed their shedding phase. Their scalp condition appeared healthy, and the follicles were gradually transitioning into the growth phase. In the coming months, noticeable hair growth and improved density are expected as the new follicles begin to mature. Before we reveal the final results of our patients, let's take a moment to understand some frequently asked questions. 1. Is it normal to experience shedding after a hair transplant? Yes. Post-transplant shedding is a completely normal part of the recovery process. It indicates that the implanted follicles have entered their resting phase before new growth begins. 2. When can I expect visible hair growth after a hair transplant? Visible hair growth usually starts between the 3rd and 5th month post-transplant. The results gradually improve over 12 to 15 months as the new hair thickens and matures. 3. Does everyone experience the same growth timeline? No. Hair growth varies from person to person depending on individual hair cycles, genetics, and scalp health. Some may notice early growth, while others may take a little longer. 4. What role does PRP therapy play after a hair transplant? PRP, platelet-rich plasma. Therapy enhances the recovery process by improving blood circulation and providing essential growth factors to the transplanted follicles, helping stimulate faster and healthier hair growth. Now let's take a look at the final results of each patient, starting with patient 2, as he visited the clinic earlier than the other 2. Patient 2 visited the clinic, completing 11 months of his hair transplant, to share his final results. By this stage, his hairline appeared perfectly defined, with the temples beautifully framing his facial features, restoring a balanced and youthful facial structure. The frontal area showed impressive volume and density, with a seamless blend between the transplanted and native hair, giving a completely natural look. The crown region displayed enhanced coverage, forming a well-defined swirl pattern with healthy, thick growth. Patient 2 was also able to style his hair freely, even getting a haircut of his choice, a true reflection of how naturally the new hair had integrated. Overall, his appearance had transformed from dull and aged to young, confident, and energetic. The results not only rejuvenated his look, but also boosted his confidence and personality, showcasing the success of a perfectly executed hair transplant. 12 months post-transplant, patient 1 and patient 3 visited the clinic to share their final results. Let's first take a look at patient 1's transformation. At this stage, his hairline appeared well-defined and naturally framed his facial features, perfectly complementing his overall look. The temples had regained their natural shape and density, restoring balance to his facial structure. The frontal area displayed impressive density and volume, with a flawless blend of transplanted and native hair, creating a seamless, natural transition. The crown region showcased a perfectly formed swirl pattern with enhanced growth, adding fullness and uniformity to his scalp coverage. Over the 12-month period, patient 1's overall appearance transformed significantly, giving him a rejuvenated and youthful look. With restored density and a natural hairline, he now enjoys the freedom to style his hair effortlessly, reflecting both the precision of the procedure and his renewed confidence. Now let's take a look at patient 3's transformation. Despite beginning with an advanced stage of baldness, his 12-month results showcased an impressive and natural restoration. His newly defined hairline beautifully complemented his facial features, giving his face a more youthful and balanced appearance. The frontal area and mid-scalp exhibited significant improvement, with dense and voluminous hair growth that blended seamlessly with his native strands. The crown region also displayed a well-formed swirl pattern, reflecting natural direction and density. This even coverage across the scalp created a realistic and aesthetically pleasing result. Overall, patient 3's appearance has completely transformed, from a bold look to a confident, rejuvenated version of himself. His results stand as a remarkable example of how advanced baldness can be successfully treated with precision, planning, and the right technique, giving him both a natural look and renewed self-assurance. Each of these 3 patients began their hair transplant journey at different stages of baldness, yet all 3 achieved equally impressive and natural-looking transformations. Patient 1, who was dealing with diffuse grade 4 baldness, initially had a receded M-shaped hairline and thinning in the frontal zone. Now, after 12 months, his restored hairline and temple density completely redefined his facial frame, giving him a balanced look. Patient 2, with Norwood grade 4 baldness, had a receded hairline and thinning crown that made his forehead appear broader and his scalp visibly exposed. 11 months post-transplant, his new, well-defined hairline and fuller crown brought back facial harmony, giving him a confident, refreshed appearance. Patient 3, who faced advanced diffuse grade 6 baldness, had lost almost all frontal and crown coverage, which made him look much older than his actual age. After 12 months, his transformation was dramatic. A naturally framed hairline, dense mid-scalp, and voluminous crown gave him a completely rejuvenated and youthful appearance. In conclusion, all 3 patients transitioned from visibly bald and aged to young, confident, and energetic, proving how a well-planned and expertly executed hair transplant can truly restore not just hair, but also personality and self-confidence. Each of these transformations is a testament to how the right planning, advanced technique, and experienced hands can completely change not only your appearance, but also your confidence. At QHT Clinic, our goal is to help you rediscover the best version of yourself with natural, permanent, and life-changing results. If you're struggling with hair loss or baldness and want to experience a similar transformation, book your consultation with our experts today. Let us guide you toward a customized solution that truly works for you. And if you found this video helpful or inspiring, don't forget to like, share, and subscribe to our channel for more real patient journeys, expert insights, and tips on hair restoration. Your journey to confidence begins with just one step. Book your consultation now with QHT Clinic.
Hello friends, if you have not subscribed to our channel yet, please like this video, share and subscribe to our channel, and don't forget to hit the bell icon so that you will get update on every video.